one thing, just teach the parents to encourage the kids to have more open communication, to relay their feelings and what's going on, because adjusting from African culture to American culture, they would need that freedom to speak and the women to just be more involved with the income. I mean, that's what I'm saying.
Thank you so much, Alette. Thank you so much, Alette. Now we are going to open now the floor for the questions that you service providers wanted to know.
As I look through these questions, I see that many of them are very specific questions that refugee resettlement agencies can answer. People want to know, and they may be too much to answer here if you can answer some of them quickly, or I know that you also can have further meetings with people to help them get a sense of these. Also, I wanted to point out that the paper that you were given, the colorful paper, is chock full of really good information. That's why we took the time to get it printed for you and not just give you a link to it. It's very dense with information, and it's just published last month by the International Refugee Resettlement, and specifically with information about the people who are coming. So there's some questions here that I'm not sure we have the answer to, but if anyone would know, it's refugee resettlement. And so I'm going to say several of them. Do you have a sense of the ages of the refugees coming? Mostly adults, mostly children? What can we expect with learning, disabilities? Will they know each other before they arrive? What is their status in terms of have they had military service? What is their education level? What percentage of them are literate? And we talked about language. And then if they want to know, where in Pittsburgh will they live? And will they get, what kind of cultural orientation will they get when they come to acclimate them? What schools will they, when they go to school, will they have had their immunizations and a TB test? And how many and what's the time frame? So this is one of the refugee resettlement agents, Leslie.
Leslie is better to answer it.
Kier could also add to this too. The United States is going to take 50,000 over the next 5 years, beginning next year. Well, the end of this year. Their fiscal year begins October 1st, so starting October 1st, we're going to see it'll build up to about 50,000 total over the whole U.S. The ages are young, parents with kids. From what I hear, at least in the first wave, very few seniors. As far as literacy, I'm not really sure. I think there's been a lot of disrupted education due to life in the camps. I'm hearing that adults would be more likely to know French. The kids more likely not. The kids knowing the tribal languages because they didn't get education in the country. I'm hearing, I'm not even sure where I'm hearing all this because I'm educating myself so much, but the women are really, maybe from one of you guys, into the trading and figuring out like home businesses. And I think some of them have already been established in Pittsburgh, hair braiding. And the men will probably work more maybe in these, the jobs that come quickly, which are usually hotel or assembly line types of jobs. That's what the indication was. As far as where they'll live, as a refugee resettlement agency, we are obligated to get them safe, affordable housing on a bus line. And we would like them to be near where their community is, and certainly we would not want to isolate them one by one all over the place. So we have been having some talks in East Liberty. East Liberty may be one place, although it's getting more expensive. It's definitely very low vacancy rate. And I met with East Liberty Development, and I don't know how likely that is. So we are going to try to build a community. I'm not sure where. I know that the churches will find them. I know some of them have vans. They can get, I really feel like wherever they go, they're going to get connected. If we can get near the churches, all the better. If you have any ideas, let me know. As far as, as a resettlement agency, we provide money for the first couple months, and then they must go to work. They'll go on cash assistance, but cash does not cover rent. So you'll see resettlement agencies losing, all of us are losing sleep over who's going to go to work. If somebody's over, well, we won't have over 65, but if we do have disabled people, we need to get that paperwork done as quickly as possible so that income comes into the home. Because it is a long process to get disability. And I know the medical partners work with us closely on this. What were some of the other questions? Immunizations. It is our job as resettlement agencies to get children in school as soon as possible. They say 30 days. The medical partners help us with the immunizations. They expedite the kids. So actually, if they come in the summer, obviously, they'll definitely be immunized. But we have to put kids in school by 30 days. We have to have health screenings done by 30 days. But we try to do this faster because of the speed at which they have to go to work, parents. Cultural orientation, we have a curriculum from the same provider that gave us this a cultural backgrounder, and we also tweak it to Pittsburgh. So we meet actually right now in this room, we got kicked out today, Wednesday mornings, with our clients in this room, and we have a curriculum around hygiene, around insurance, around apartment safety, around 911, around insurance, or, oh, I think I said that. What education, how you should be, we have educators come in, people from the medical world come in, English, the importance of English. As far as English is concerned, the issue with the English is really around the bus. The English classes are free of charge. They all get referred to Greater Pittsburgh Literacy Council very quickly, and they're willing to take them, or the Allegheny Intermediate Unit. The problem is they can't get there. So there is funding for the employables in the home to get to English with a bus pass. If they're mom at home, or the kids get it in school, but for adults, unless they go to work right away, they won't get a bus pass. And then it becomes more challenging for them to get to English. And this has been a problem, it's occurring now. There are some community-based English classes. And we'll try to do that as much as we can. If people are living in close proximity, I know GPLC, AIU has put some English classes nearby, but it is truly a problem. And we do use volunteers. Our agency has a volunteer program to help with. We put them in the home, and they work with the families as a supplement.
Thank you.
Excuse me. No, it's okay. Yeah, quick.
I just wanted to add something about giving those people a shot. We have to be very, very, very careful with that, because like Rebecca was saying, we really need to scan those people. Because personally, I have a cousin of mine, when she came here, got a shot, I think it was tuberculosis, and now she's paralyzed. Just because, there's some shot we already have from the Congo. When you come here, we get those shots. You have great reaction about it. So please, I'm not in the medical world or anything like that, but this is my personal experience. Make sure we scan them very well to prevent any kind of stuff like that. Thank you.
I'd like to ask, I know that the Squirrel Hill Health Center does most of the screening for the refugees that come here, and they also, they have a lot of experience dealing with that. I'd like, Dr. Fox, would you like to give any reassurance about what happens?
Hi, I'm Andrea Fox. I'm the medical director of the Squirrel Hill Health Center. We see now almost, but not all, of the newly arriving refugees coming to the city, in the area. And we've been really pleased to do this. This is actually part of our mission since we opened about 7 years ago. The state actually has requirements for vaccinations, which we provide. All patients are scheduled actually for an initial visit for us within 30 days, sometimes sooner, of their arrival with us, which takes a lot of juggling often. And for children, for all adults, they're actually seen again 2 months afterwards. So the idea of trying to get them used to preventative care is really important for us. We consider ourselves a primary care center where we do outreach and continued care. For the vaccinations, actually they're required, everyone is required to have a tuberculosis screening when they come in. I don't know what caused the person of paralysis, but it probably wasn't the tuberculosis test. Some people come in with a status already of tuberculosis where they actually have to go immediately to the health department. And we, for the most part, try to work with the health department around people who have been exposed to tuberculosis. If they have noticed that, they have to get a chest x-ray. We work closely with our refugee resettlement agencies to make sure that happens. In order to get a green card, you do need certain vaccines, and we try to get people up to their vaccines as quickly as we can, because that's very important. And for the